Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And I'd like to welcome Dr. Afreen Shariff and Dr. Mary Leung. Thanks for joining us today, Afreen and Mary.
Well, thanks for having us.
Thank you.
You're very welcome. And by way of introduction, Dr. Afreen Shariff specializes in endocrine disease and cancer, and she's the co-founder of Citrus Oncology. Her tagline includes "Every cancer journey matters," which totally resonates with me. As you both know, I've had 3 separate cancers in the last few years, so I appreciate both of your work. Thank you so much from the bottom of my heart. And Dr. Mary Leung is a full-time physician who specializes in medical oncology and hematology, and she's also a certified professional coach helping physicians reduce their charting time. And we shared an episode about that about a year ago, so we'll have to link that one also. And Mary's passion is to help patients to the best of her ability, which dovetails perfectly with Afreen's mission and why I thought it would be great to have the two of you on together. And today we'll be talking about how Afreen's work includes triaging and managing cancer side effects, and she doesn't believe in treating symptoms as symptoms. She says symptoms are often due to a side effect or a toxicity involving the heart, lung, kidney, skin, or endocrine system. And Mary, as a hematology oncology physician, will share her perspective in response to Afreen's approach. And I thought this topic will have broad appeal because doctors in every specialty have patients who present with cancer. So this will be educational for everyone, doctors and patients alike. So my first question is, what would you most like our audience to know about you as we begin our conversation? And Afreen, would you like to go first?
Of course, I think Kim, I could not have summed it better than you did with what we both believe in. And I think there's a common denominator but me and Dr. Long that keeps us together, that patients come first, right? And I think that's what we all believe in, and in the bottom of our hearts, this is why we do what we do. This is why we wake up every day. And this is why we love taking care of absolutely rewarding folks and individuals with cancer. I never say cancer should define your life. It's part of your life, and they come in every day and they teach me a thing or two. And I think, patients come first, and that's what I believe in.
Yeah, well, thank you. That's so beautiful. And Mary, what would you like to share?
Yeah, I think, even though this is my first time meeting Dr. Afreen, I think we can become good friends because I share the same view. Yes, patients come first. Of course, that, it's after we take care of ourselves, because without health, we can't take good care of the patients. And that being said, is that I think, taking care of the patient is really more than managing their diagnosis, is really taking a step back and taking a look at the big picture, at the whole person. And even though we have national guidelines, standard things to do, it's like, is that exactly suitable for the patient? So I think that and what the patient actually wants. So I think to address that is so important, and to be able to collaborate with other specialists, that's really important because medical advances are really beyond, I don't, compared to what, 50 years ago or even 30 years ago, right? It's so much more. It's like you can't just have one doctor take care of everything. You have to have different specialists because even within the specialty, the technology, the advancement it's really like we can barely catch up sometimes. Yeah.
Yeah, I love all of what you just said. And also, medicine, that's the art of medicine and using your clinical judgment, right? And really listening to the patient. So I love the way you say that. Thanks, Mary. And Afreen, would you like to share a bit about Citrus Oncology, maybe how you got started with that and what exactly you're doing?
Course, of course. So I am an endocrinologist, as you all have already heard, and I grew up in the space of side effect management. I started doing this about 10 years ago. Mary knows this very well. This was around the same time the landscape of oncology was really changing, right? Because we are moving from the traditional chemotherapies and radiation treatments and the archaic ways of doing things, and we were looking at the holy grail of oncology, like immunotherapy, using your own body's immune system and ramp it up to kill and target cancer cells, which are your body's own cells that look and act differently. So it made a lot of sense. And when I jumped in and doing this, I've kind of been doing this around 10 years now. I realized along the way, during talks, during meeting very smart people around the world, that, there's such a need for expertise that manages side effects. Because I've never met an oncologist that has ever been able to treat cancer without a side effect, right? Whether it's severe, it's mild, side effects are part of the puzzle, and we can't keep pushing it under the rug, that this is part of the deal and this is okay, if you're 6 feet above the ground and you're suffering, but you're cancer free, that's okay. We're moving away from that. I don't believe that living 6 feet above the ground and having all these side effects is a way that we should be looking at our patients. It's a success, but is it truly a success? We need to ask ourselves that, right? So that's when I sort of started thinking about an approach outside of kind of the ivory towers of medicine. There are people like me. I'm an associate professor at Duke. I've been at Duke all of my career pretty much, and that kind of expertise is housed in the Sloan Ketterings, the Dukes, the MD Andersons. But 85% cancer patients get treatment outside of these centers. What's happening with them? You and I can't get into seeing an endocrinologist or a cardiologist, and the wait time's 3 months, 6 months, 8 months. Imagine if this was a cancer patient. What do they do? Their treatments are held, they're being hospitalized, they're suffering while they wait for their treatments to continue, or their treatments are being changed because of side effects. So the problem is not local, it's a global issue. And we are living in an era where survivorship is now a good problem to have, but it is a problem that needs to be addressed. Throughout my years of 10 years, we didn't have people living for 10 years with cancer. We do now. I've had patients living with that for many, many years now, and they're flourishing, they're thriving, right? I don't like using the word survivors because people should thrive after their cancer journeys. So what are we doing about that? So this is where I decided that let's team up and let's start a company that basically provides virtual access and fast-paced recommendations to oncologists to provide side effect care. And that's support. Like Dr. Long was mentioning, never before in medicine have we all worked together as a team like we do today, because we just need each other to take care of our patients. And how can we get access? And the best way to do that is to democratize that approach to side effect care. Make it fast, make it easy, make it high level expertise that is available at the fingertips for patients and oncologists around the country, so that they can push a button and get an expert to weigh in and give an opinion within 72 hours about a side effect, whether it's an endocrine side effect, whether it's a cardiac side effect, whether it's a rheumatic issue, whether it's a skin issue, it's a heart, it's a lung issue. They have access at their fingertips. And that was the idea behind starting Citrus Oncology. And we are now in multiple states and very excited to see how this uptake has been so far. And I mean, there was a need, but seeing it grow and seeing other people want this kind of service is really validating for the fact that there is such a need and such a room for improvement in the status quo.
That's, really important, especially you mentioned that with, a lot of specialty care like endocrinology, and I have come across this myself too. It's like sometimes, when the patients are not established with an endocrinologist already, it is tough to get a new patient appointment, in person. And it's like sometimes it's, yeah, really 3 months. And then I'll have to pick up the phone or have my office pick up the phone and say, hey, I need this patient to be seen now, to force my way in. And if I have to do this for every single patient who needs, endocrine help for side effects or anything, then it is not really, I guess conducive to comprehensive care for oncology patients and other patients too. So I think that what you started, Dr. Afreen, it's really amazing to be able to have quick access for patients and for clinicians too. It's just to say, okay, you know what? Before the patient can be seen, it's like, what can I do right now? Because, endocrinology is not my specialty. I mean, I kind of learned it in medical school. I kind of did some in internal medicine residency, but that's about it. And as you mentioned, there's just so many more side effects now with endocrine because of the immune check, the checkpoint inhibitor therapies that we have been using left and right, really like water now, almost for all kinds of cancers, and we see a lot, a lot of thyroid issues, a lot of pituitary, all these different things, and sometimes we don't even recognize it, and when patients say that they have headache and fatigue, we may just say, oh, it's a side effect. But it may be really more serious than just a side effect. It may be an endocrine issue. So I think that it is so important to have quick access to the care that the patients need.
Well, thank you, Dr. Long, for validating what I said. And it's really nice to see that, this resonates with you and with your practice as well. I think we're all in the business of helping people out. And, if we don't have the right tools in the toolkit, it's really hard to help people out. It's kind of like you're trying to build an airplane while you're flying it. And if you don't have the right tools to do that, you know how that's going to go. And we're trying our best. And this is, it's not a one-stop solution to everything, but it's better than what we have today.
That's for sure. And I think that as you mentioned, that you're available in several different states, and that I really look forward to it being more widespread, like nationwide, and just have I think more. And you mentioned also that there are different specialties too, that because in oncology there are really a lot of different side effects. You can name it, it's like every body part can play a role, especially with immunotherapy. So I think that cardiology, of course endocrine, and all these other specialties are, if we can just all work together, just a coordinated effort to be accessible for patients so they're taken care of, then I think that, as you mentioned, I also believe that the quality of life of the patient is so important. It's not just, oh, I lived through this, and just barely surviving, as you mentioned. It's really, we want the patient to thrive. We want the patient to do well, and almost as if they don't have the cancer, because they're not really feeling much of the side effects, and or they're really being well managed. Just like, someone with high blood pressure, they don't feel it because they're being managed, and by the time that you feel something, it's too late. So I think that because as we, human beings are living longer, there are just more chances to have cancer, and which means that more people are going to be treated for cancer and side effects. Everything has side effects. Every medicine does. So I think that we can just work together, and also I think for me, it's like, okay, what the initial things to look out for, that I can kind of manage initially, and then I can have more help, before the help comes, type of thing.
Kind of like packaging it up. I say simmer down the problem until it can be handed off to the next, handing
Exactly.
the baton, right? In medicine, that's what I often say, is that every team has their own very good expertise, and that's what we want. We're in one way, fortunately or unfortunately, not generalists, right? There is such a need for generalists where they're able to be the traffic cops or the folks that are directing traffic and saying, you got this problem, this is where you go. I can handle this, and you need to go to this physician or this provider to get this particular problem managed. And then we have these folks that are really deep into their specialty, which is also very important, because then they really need to know everything about it to solve that problem. So just like Dr. Long said, I could probably do a few chemo orders or something. I've done it, but I'm not good at it. Right? We've all learned all of this during our training, but it doesn't mean we're experts in it, right? Like I know nephrology, I know rheumatology, I know hemonc, but I know endocrinology way better than all of the above, right? If you ask me an oncology question or a rheumatology question, I'm going to question myself twice before I put that order in. But if you ask me something about endocrinology, I'd be able to do it in my sleep, right? So that's the difference. That's the kind of people if you are a patient, that's the kind of people you want to go, right? It doesn't mean that the doctor sitting in front of you or the provider sitting in front of you is not aware of how to do this. It's just that that's not their expertise, right? This is not what they're trained to do. And they're trained to do something really well. And if they tell you, hey, you know what, you got to see a rheumatologist, you got to see a cardiologist, they're saying that, hey, this is where the buck stops with me. And I think you need a slightly higher level of expertise that I don't have. And I think in medicine, it's so, so important to know what you know, but even more important to know what you don't know. Because in practice, this is where I see most of the damage happening is when people think they know everything and don't question their expertise or their abilities. You know, it's very humbling in medicine. There's the science of medicine, and then there's the art of medicine, Kim, that you kind of mentioned about, right? If medicine was a science, then, you know, we wouldn't be practicing the art of medicine, right? And that's where the difference comes, is that we all know the basics and we know that, but we don't do it every day to be very comfortable. And you know, when we give recommendations through Citrus, it basically supports people like Dr. Leung and med-oncs and providers in the oncology field to comfortably and confidently move forward with a plan that they probably were thinking about already, but it allows them the comfort that, hey, there's someone else who's looked at this case and is agreeing with my plan, right? And also agrees with this, or maybe doesn't agree with this, and they have a better plan than I did. And that's the beauty of it. You're preventing someone from going to the hospital. Because if you don't manage that side effect, either Dr. Long's team is managing that patient, they're getting calls from the patient, messages from the patient, repeated visits to their office because of a problem, because they're either itching, they're having diarrhea, they're having high blood sugars. They're trying their best to manage this until they can see an endocrinologist or a cardiologist or a gastroenterologist. And by allowing them to get that expertise from the cloud, they're able to move forward with the treatments. I mean, that's such a win-win for everyone, right? So this was a format that we believed, and this has been my experience at Duke as well, where it's highly access focused, and we were able to lower hospitalizations through these MD to MD consults for endocrine toxicities by more than 70%. So it's a proven case that when oncologists receive recommendations, even if it's from the cloud within 48 to 72 hours, you can lower hospitalizations. That's a big win. That's a big win. If you can keep someone out of the hospital because of a side effect, that patient's more likely to continue treatment. Unlike someone who's in the hospital because of a side effect, when they come out, they're talking to oncology teams and Dr. Long's team saying, I don't want to ever go back on that treatment. That got me into the hospital. I want you to think of something else. And I'm sure Dr. Long's team is talking to patients. This is a very good treatment for you. It really works. We have all the markers to say that this is the best, most effective treatment. But the patient's not convinced because that's the problem that got them into the hospital. So this is where, you know, it's an unmeasured territory of the impact of fast access consultations, but you can derive the impact of all of this on everyday patients that we're seeing.
I agree. And I think with the convenience for fast access, it's also the clinicians are more willing to be open about asking for help, because sometimes it's like, oh, it's so hard to get someone to ask, and I should just figure it out myself. And then that's what happens, as you mentioned, that, oh, you may not manage it, to the optimal way just because that's not an expertise. And then, the patients end up in the hospital and they don't want the treatment anymore. And that has happened, and because it is kind of like a post-traumatic thing for the patient. It's like, well, this treatment, it's supposed to do some good to me, but then I suffered from it. Why would I want that again? And some patients opt not to um, do any treatment anymore even. So I think that with the fast access and with the experts, in the panel, that is really so helpful for not just oncologists, but just for the doctors who are treating the patient to really say, hey, okay, this is good. This is what I'm going the right direction. That's what I'm doing, and I have support. I have people backing me up. That hey, we're all on the same page.
So, given that Mary is the one that we have on with us speaking to this, Afreen, and she's in New York, I don't know if that's one of the states you're in. Okay, great. So, as an example, can you share? Or
No,
no, not. Okay.
not yet in New York, but we are looking to start. We have a team of physicians already in New York right now, who are licensed in the state of New York, but we haven't launched yet, but we will be.
Okay, so that's awesome. So when you launch, maybe if you could share specifics for our audience, how you could exactly support Mary and doctors like Mary and patients like Mary's patients, like how it, logistically what would actually happen.
Yeah, absolutely. So we're active in the state of Florida right now, and we are running partnerships in the state of North Carolina and South Carolina. We will be starting in Texas, Ohio, and Virginia as well. So we're rapidly expanding, and we started services in October of last year. So we're like 3 months into this, and we're very excited to see this kind of uptake. And the way it works is that, especially for the MD to MD consults, when say Dr. Long has a patient who she wants to send over to us, and we're active in the state of New York. What happens then is that we start working with Dr. Long's practice. We set up a partnership. We set up operations where we tell them, educate them, this is how you put in a consult, etc. So Dr. Long's team would put in an e-fax or an e-referral to our team, and we collect relevant information about the specific problem. For example, if it's a thyroid case, we'd get information. Our intake specialist will reach out to Dr. Long's team, get information from the patient's EMR, and get records relevant to the thyroid problem and send it over to our expert endocrinologist on the other side, who will review that case within 48 to 72 hours and give written recommendations. For example, if it's a case of hypothyroidism, then we would put in recommendations on please start this page, please get these labs if these labs are not done yet. And if the labs are done, we review the labs and suggest what dose of levothyroxine to start the patient on, when exactly to check repeat labs, and also give suggestions on if, say, the TSH is above X, then please increase the dose by X to this dose and repeat labs in X number of weeks, right? So that allows Dr. Long to take an action on the problem in front of her and also simmer down the problem for the next, what, 16 weeks. And while they wait to see an endocrinologist in the outpatient setting. Now, in Florida, what we do is we also do direct patient care, where we accept insurance. And this is the same way we will be moving into different states as well. The reason for this is that we first start with MD to MD consult in every state and see what the uptake looks like before we get our physicians credentialed in that state. So in the state of Florida, we do both. We do MD to MD consults and we do direct patient care. In the other states, we're just doing these MD to MD internal consultations to support oncology practices. But in Florida, we accept insurances. We directly take care of patients. For example, if there's a case of rheumatoid arthritis that Dr. Long has and is concerned about it, our team will review the case, give recs on the labs, review those labs and say, well, this patient has rheumatoid arthritis and the patient needs to see us in our virtual clinic. And we absorb the patient in our virtual clinic, bill insurance. So there's no extra cost to the patient. It's just like any other virtual appointment. And we co-manage the case with Dr. Long's team to ensure that we're managing rheumatoid arthritis while Dr. Long is managing the oncology related issues. So it's kind of very parallel, kind of co-management, team-based approach that happens at that point. And we will be moving into other states in the same format where we do MD to MD and direct patient care. It's just a matter of when we move into different states. And right now we have about 150 US board certified physicians on our platform from many different specialties like cardiology, endocrinology, rheumatology, nephrology, derm, palliative care as well. And we'll be adding other specialties. But at this time, and we're a growing practice. We have several folks that join our platform, several physicians that join our platform every month.
I think, it sounds like it's growing so fast because you just started last year and just a few months ago, actually. So I think, but it's just the model that you have. It's really for the patient, and it's as you said, it's like parallel. It's co-managing the patient, and that's what the patients need. It's for for this collaborative effort to take care of everything. And so it's like, and the thing is, it's like for oncology patients, for example, for me, I work full time and my schedule is average, 15 minutes per patient, follow-up patients. And in that 15 minutes, I'm supposed to listen to all the side effects, maybe do chemo orders and, order labs and everything, right? So I think that, not, so sometimes you may not be able to really talk about everything, all the side effects, or we may just have to really put out fires first and say, okay, these are the three main things that we'll address, and then the other things we may have to wait, so I think, with the access, with the easier access and faster access, then one can say, okay, okay, this is the issue, and let me, talk to the endocrinologist, or if there is the direct patient care model, then we'll say, hey, let me send you over to see what we can do about your thyroid issue or something like that. Yeah.
Well, that's good to hear. That's good to hear. I'm happy that there's such an interest about these services, and certainly a need that there's been a gap for a very long time, I think. And when I started doing this 10 years ago, I didn't really understand why other people were not doing this, frankly. Because I was like, I can't be the only person thinking about a field of endocrinology and oncology, right? Like, this has to make sense. I mean, endocrine disease especially is so common in cancer patients, like steroid hyperglycemia or just high blood sugars. I mean, 20% patients have diabetes at the time of cancer diagnosis, which only gets worse with
Yeah.
cancer treatments. Like this is like the elephant in the room, right? And 10 years ago when I started doing this, I'm like, this is not a new problem, right? This has been there. Why aren't people taking care of this, right? So it's so nice to see that there's such a move towards this very collaborative model of taking care of patients, and just a very collegial kind of environment. My best friends are oncologists. Like, I work with oncologists. I know more oncologists than I know endocrinologists, all right? And I absolutely love them because they're great human beings, just empathetic. They are in that profession because they care. They really care about patients, and they're just the best people to work with. I have really enjoyed my career because of working with folks like Dr. Leung, who just like are so collaborative and so welcoming to other specialists co-managing their patients. Because some folks don't like other people managing their patients, but I don't see that with oncologists, right? And they're just so welcoming.
I have
Yeah.
to agree. Sorry, I was going to give a shout out to my own medical oncologist, Dr. Michael Cohen-Erm. He's amazing. And I know Mary personally, and she's amazing too. And as we wrap this up, well, I'll have you each speak one more time. Like, Mary, any final words from you and how our listeners can get in touch with you? And then, Afreen, when we circle back for final words for you, if you could then also share who pays for the MD to MD consults parts. Okay, go ahead, Mary.
I think for me, I think in the beginning of my career, I would be like, oh, am I doing this correctly? Did I do this right? But then I'm afraid to ask people for help because I'm like, I'm supposed to know everything, right? And I think as I get older, not necessarily wiser, but more experienced, that I was like, well, it is okay not to know everything because we're not supposed to know everything. We're not perfect, and that's okay. It's just, it's important to know when to ask for help. And that's why I say, hey, if I'm open to ask for help. It's like endocrine, cardiology, rheumatology, please help me, manage this patient because it is all about the patient. It's not about me. It's like, if I don't know that, that's okay. It's, we'll find someone who knows it to take care of the patient in a timely fashion. So I love this collaborative approach for, better patient care. And I really feel honored to have met Dr. Afreen today virtually. It's amazing. So I guess to find me is well, I don't really represent my institution for today, but myself as Kim mentioned that I'm also a life coach for physicians to help with time efficiency and cutting down on charting time. So you can find me at shiningwithgratitudemd@gmail.com, and also my website, shiningwithgratitudemd.com. And I think that this is really amazing that Kim, you organized this little session of meeting interview for us to meet and just to really discuss this very important topic, with patient care and with physicians all working together for really better medicine.
Well, thank you, Mary. I was thrilled to introduce you to each other, so I'm so excited to publish this soon. And Afreen, if you have a few parting words and how our listeners can get in touch with you.
Absolutely. I think this was just a fantastic conversation. Absolutely loved every part of it. And Kim, you spent so much time learning about us before you even get us together. You know, you're the catalyst that makes it happen, but you spend your time and energy learning about what drives each person. I think that's the most impressive part about, the work that you do, is that you really care. And Dr. Long, just getting to know you, it's been absolutely fantastic. I'm certain I will connect with you after this and we'll have deep conversations about how we could drive this forward. The things that I want to share, especially towards patients, and like I've said earlier, about the very collaborative environment. And you've mentioned this, Kim, as well, that symptoms need to be figured out if they are signs of a problem. I cannot tell how many times this happens where patients continue to suffer because of a side effect, because their symptoms are being put off, saying that, oh, this is because of your cancer. That is something that I think patients need to know, that question, that is my symptom only because of cancer. And I'll tell you this, individuals with cancer, they don't complain. They just don't. They write it off themselves. They chop it off at the chopping block and say, this is because of my cancer. I'm not going to call Dr. Long. I'm not going to call Dr. Sharif. I think it's because of my cancer. So I think it's important to talk about it and share that so that someone can take action about it. And then that someone who's listening on the other side should also not write it off saying that this is part of your cancer. You can't tell that until you know, until that is the bottom of the list. You need your differential on top. And cancer-related fatigue is really after you removed all that exclusion out. You removed a thyroid problem, you removed diabetes, you removed adrenal insufficiency, you removed rheumatic issues or cardiac issues. There on the bottom is fatigue from cancer. It should never be the primary diagnosis. So that's something I want to share. If patients are listening, if other clinicians are listening, it's our responsibility to listen to our patients and to understand that this could also be a sign before I call it off as just a symptom. So that's one pet peeve I always say. Now, Kim, you asked me who pays for these MD to MD consults. Now, typically when we start working with systems, we contract with them for either a flat fee for each of these consultations, or what we work with is we start billing insurance. There are already existing billing codes for this. It really depends on the contract process that we have with these individual practices. Now, patients can themselves go on the website and actually book their own expert opinion. And we try to keep the pricing at a point that it is similar to a doctor's visit. It's not like a concierge where you're paying thousands of dollars to get an opinion. I think that's just an overkill. And it's just adds to the financial toxicity of our patients, and I'm not an advocate for that. So we tried to keep the pricing close to what anyone would pay out of pocket for any doctor's appointment around the country. So yes, it's not free because we still have to pay the doctors on our other side, right? So we can absolutely make it free, but there's certainly a cost to it, and practices are welcome to reach out to us. We have info@citrusoncology.com for practices to reach out to us. And if there are physicians who are interested in multiple different specialties to join us as a team member, they can reach out to us at joinus@citrusoncology.com. And if patients just want to go on the website and learn more and book an appointment themselves, especially in the state of Florida, we welcome that. We will be expanding to other states, as I mentioned, but you can go to citrusoncology.com and you can access all this information that I talked about and book your own appointments to get an expert opinion.
Well, thank you so much. I'll share all that in the show notes. And thanks again for being my guest today, Mary and Afreen. I think this is a really important conversation, and I'm looking forward to sharing it. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.